Case 16, 2017. A 69-year-old woman with urinary incontinence. Definition. The International Continence Society defines urinary incontinence as any involuntary leakage of urine. Urinary incontinence is estimated to affect 200 million people worldwide. The prevalence of urinary incontinence in women is variable in the literature, but it is reported to be as high as 55%. This number may be an underestimate because up to half of women may fail to report urinary incontinence to their healthcare provider. This may be due to embarrassment, lack of knowledge about treatment options, or a belief that urinary incontinence is a normal, inevitable part of aging.
Stress urinary incontinence in women. Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice. There are two sphincters, or valves, that keep the urethra closed to prevent leak. Internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located right above the external urethral orifice and is supported by the pelvic floor muscles. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord and the brain. At times when it's not appropriate to urinate, the brain sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When you wish to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder, the detrusor muscle, to contract and the sphincters to open to let the urine out. In stress incontinence, small amounts of urine leaks when the person is sneezing, coughing, laughing, or having any activity that creates abdominal pressure on the bladder. This usually occurs because the pelvic floor muscles are weakened and can no longer support the sphincters. In women, this typically happens as a result of pregnancy, childbirth during which these muscles are overstretched. In most cases, this condition can be treated with exercises that strengthen pelvic floor muscles.
Applications in medicine. Patients with incontinence should be referred to a medical practitioner specializing in this field. Urologists specialize in the urinary tract, and some urologists further specialize in the female urinary tract. A urogynecologist is a gynecologist who has a special training in urological problems in women.
My name is Howard Goldstein. I'm a urogynecologist here at the Center for Urogynecology and Pelvic Surgery at Christiana Care. Urinary incontinence is a condition that affects women whereby they have the sudden urge to leak urine that's uncontrollable. There are different types of urinary incontinence that exist. Stress incontinence is a condition where a woman would cough, laugh, or sneeze and leak urine. Urge incontinence is another type of incontinence where women would feel the sudden urge to go to the bathroom and are unable to make it to the bathroom. And then there's mixed incontinence, which is a combination of both stress and urge incontinence. Here at Christiana Care, when a patient presents with incontinence, our first job is to figure out the type of incontinence the individual has. Once we discover that, then we will partner with the patient to discuss the different options available, both surgical and non-surgical. Once the options are laid out, it's really up to the patient to decide how she wants to proceed with the treatment. There are therapies such as physical therapy, medications, and dietary modifications that can be used to help treat urinary incontinence. Physical therapy would be teaming a patient up with a physical therapist trained in this type of therapy, where she would teach you how to strengthen the pelvic floor muscles to make them stronger, and so you would have better bladder control. that type of therapy can be extremely successful. Medications are available for these conditions, depending on the type of incontinence the woman has, would help tailor the type of medication that she would need. Behavioral or dietary modifications can also be quite useful. Looking at one's intake of food and fluids and the type of fluids one consumes, such as caffeine or alcohol, can have a tremendous effect on the bladder function. All of the surgeries available at Christiana Care are surgeries that take between 15 to 20 minutes and are outpatient surgeries. Very often the patient can be back to work within 1 or 2 days, and the downtime or recovery would be very quick. The surgical treatments can be extremely successful with cure rates upwards of 75 to 80%, depending on the type of surgery and the situation that the patient is in.
Pros. Issue apply in Ecuador. There are 4 main types of incontinence. First one is urine incontinence due to an overactive bladder. Stress incontinence due to poor closure of the bladder. Overflow incontinence due to either poor bladder contraction or blockade of the urethra. Functional incontinence due to medication or health problems, making it difficult to reach the bathroom.
Hi guys, Dr. Deanna DeToro. I'm back and we're going to talk about incontinence. So what is that? That's basically the inability to control contents of the bowel or bladder leaving the body. And today we're specifically going to talk about urinary incontinence. So there's a couple different kinds. Stress incontinence is generally when you think of if I cough, sneeze, laugh, jump, run, and I leak a little bit, that's going to be your stress incontinence. Urge incontinence is maybe you didn't feel like you needed to go to the bathroom, all of a sudden you get home, you get the key in the door, you're like, oh my goodness, I can't wait to go to the bathroom, I need to go right now. That's going to be a little bit of urge incontinence if I leak when I have that kind of urge. Mixed, it's kind of a mixture of both, so that's pretty self-explanatory. Functional, we don't see too much in a younger population, but maybe if you have a harder time with mobility and actually getting to the restroom, so maybe you have arthritis or some other issues where you can't get to the bathroom on time. That's going to be functional incontinence. Keep in mind that some neurologic issues, diabetes, multiple sclerosis, other things can affect continence, but we just at least like to identify what kinds there are. That's all I got for today. Talk to you guys later.
Pros and cons. Pros. Treatment options range from conservative treatment, behavior management, bladder retraining, pelvic floor therapy, medications, and surgery. The success of treatment depends on the correct diagnosis. Weight loss is recommended in those who are obese. Cons. Incontinence is expensive both to individuals in the form of bladder control products and to the healthcare system and nursing home industry. Injury related to incontinence is leading cause of transmission to assisted living and nursing care facilities. More than 50% of nursing facility admissions are related to incontinence. Conclusion: bladder symptoms affect women of all age. However, bladder problems are most prevalent among older women. Women over the age of 16 years are twice as likely as men to experience incontinence. 1 in 3 women over the age of 60 years are estimated to have bladder control problems. One reason why women are more affected is the weakening of pelvic floor muscles by pregnancy.
Urinary incontinence is twice more common in women than in men. About 1 out of 3 women over the age of 60 is estimated to be incontinent. Pregnancy, childbirth, hormonal changes during menopause, and anatomy of the urinary tract account for this difference. Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice. There are 2 sphincters, or valves, that keep the urethra closed to prevent leaks: internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located right above the external urethral orifice and supported by the pelvic floor muscles. The urethra is much shorter in women than in men. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord and the brain. At times, when it's not appropriate to urinate, the brain sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When you wish to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder to contract and the sphincters to open to let the urine out. Urinary incontinence is involuntary leakage of urine. There are several types of urinary incontinence in women. Stress incontinence: urine leakage while sneezing, coughing, laughing, or any activity that creates abdominal pressure on the bladder. This usually occurs because the muscles or tissues underneath the bladder are weakened and can no longer support it. In women, this typically happens as a result of pregnancy and childbirth, during which these muscles are overstretched. Stress incontinence symptoms usually worsen during certain times of the menstrual cycle when estrogen level is low. Incidents also increase following menopause. This is by far the most common type of incontinence in women. Urge incontinence: need to void that cannot be deferred, inability to hold. This is commonly caused by an overactive bladder, a condition in which muscles in the wall of the bladder contract in an uncontrollable manner. The reason why this happens is unclear, but it's likely to involve problems in the nervous system. Overflow incontinence: constant dribbling of urine. This happens when the bladder does not empty properly while voiding, making it almost always full and urine overflows. This may be due to weakened muscles in the bladder wall or a blocked or narrowed urethra. This type of incontinence is rare in women. Treatment depends on the type of incontinence and severity of symptoms. Lifestyle changes: limit fluid intake at certain times of the day, such as before going to bed or before a long trip. However, note should be taken to increase fiber content in your meals to prevent constipation. Cut down on caffeine, alcohol. Keep a healthy weight. Try pelvic floor muscle exercises, such as Kegel exercises. This is to strengthen the muscles that support your bladder and is particularly recommended after childbirth. Timed voiding or bladder training therapy. Plan regular trips to the bathroom at set times of the day. Gradually increase the interval between trips as you gain control. Small leakage can be managed by wearing menstrual pads. Medication: depending on the cause of incontinence, the following types of drugs may be prescribed. Anticholinergics: these act on nerves to block bladder spasms for treatment of overactive bladder. For stress incontinence, topical estrogen may be applied as a cream or patch. Estrogen helps